to this afternoon's webinar from Public Health Network Cymru about Communities for Change. My name is Kieran Humphreys. I'm a consultant in public health, and I lead the Wider Determinants of Health unit, which runs the Public Health Network Cymru. I'm really pleased this morning we're going to be talking to you about our experience developing and piloting this Community for Change approach. The Public Health Network has been growing and expanding. It's now got over 2,500 members, and it is really good at sharing and exchanging information between members. But this idea of Communities for Change came about as we thought, well, could our network help support people make change happen in the complex world of wider determinants of health? What might work? What would that look like? And how would we do it? So that led to the idea we're going to discuss today. And we've got 4 speakers who will take you through the whole journey from conception to piloting, income TAF, and on to evaluation. So really pleased that we'll get a chance to hear about that. I've got a few housekeeping points. Firstly, if I could ask you all to write any questions you want in the chat bar on the side. We welcome contributions in English and in Welsh. This session is going to be recorded, and the recording will be put on the Public Health Network Cymru website a few days after. And finally, if you've got any technical problems, please just drop a note in the chat and we'll try and sort them out for you. So I'd like to introduce our 4 speakers today. They are Catherine Winding from Public Health Wales, Gwenno Edwards, Christian Heathcote-Elliott, and Philip Daniels, and all speakers will introduce themselves a little bit more and say where they're coming from to introduce their part of the talk. I look forward to hearing you further. Catherine, over to you.
Great. Thank you, Kieran. So welcome all. Firstly, just quick what we're going to be doing today, the webinar aims. So what we're going to start by doing is describe the development of how this came about, what it looked like in practice. We're going to discuss some of the outcomes achieved by the pilot collaborative, and then present an overview of the findings from the evaluation and some key learning. So to start with, how the Communities for Change Wales approach was developed. So what we did as a team in the Wider Determinants of Health unit was identify existing change and innovative methodologies used in healthcare and public health. Some of these include large-scale change, quality improvement approaches, the public health innovation model, and Nesta's people-powered results. And then the next step, along with guidance from the Public Health Wales Evidence Services, we undertook a snapshot literature review of grey and published literature to answer the research question, what methods are most effective to engage individuals from multiple organisations in achieving collaborative goals? Once we had identified some core sources, we then used citation tracking to identify additional relevant literature, and we looked for common elements across this literature that were essential for collaborative multi-agency change. And then lastly, we also had conversations with subject experts such as subject experts from Nesta, Improvement Cymru, and Dr. Etienne Wenger, who is very much in the space of communities of practice. And we were interested in learning from their experiences, from what they felt were critical factors in terms of delivering a successful change program. So that's how it came about. We wrote a blueprint for what we believe were essential components and key principles for this approach to work. And some of these core components were sponsorship, adaptive leadership, a focus on impact, insights and data-driven, end-user involvement, facilitation, intersectorial collaboration, a time-limited approach, and an iterative process to derive a solution. We viewed these components, although core components, as sort of ingredients for a recipe where some collaborative might need a bit more, one ingredient than another, And this is very much dependent on what the problem is, what the collaborative would like to solve. So one thing that came out really strongly in the literature was that iterative process to derive a solution, especially in terms of transformational change, and also the facilitation. So depending on the nature of the problem, the nature of the collaborative, coaching support may also be provided to the leaders of the collaborative by the non-expert facilitators. And second part of the blueprint was the life cycle. The life cycle, it's got 3 parts to it. We've got the orange. Let's see if this will work for me now. So I'll just zoom in for you so you can see it. The orange is the preparation phase, where you agree sponsorship, you look at the scoping and the planning, and then you've got the blue, which is an action phase, where you start to build the commitment, making the relationships, you clarify the issue, you start agreeing goals, you agree your preferred solution, developing and implementing solutions. And then the final grey part, the follow-up phase of the life cycle, is where you start assessing the impact that your collaborative had. So for each of these slices, the blueprint contains a guide on how to do this, things like what good looks like, what some of the key questions for facilitators and leaders are, and it also includes things like tools and activities that you can use in your sessions. So those are the 3 cycles of the Communities for Change life cycle. In developing the approach, we also developed a theory of change. This was developed with support from QLab Cymru colleagues and as a project oversight group, which included wider determinants of health colleagues, the facilitators, and QLab Cymru. This was developed in one of our development sessions that we had. The QLab Cymru colleagues really helped us separate the approach from the pilot collaborative and make sure that we were focusing on what we wanted out of the approach rather than the collaborative itself, because they have different outcomes than what we wanted to see from the approach. So they really helped us develop a theory of change for the approach. The theory of change is really small. I know you can't see it, but we've got things like activities, impacts, outcomes, and in all the little stickies on the side that feed into all that are assumptions, evidence, and enablers. Some of the impacts were quite hard to see and measure due to time constraints. So things like an individual and collective mindset developed for growth and experimentation. We didn't have that baseline measure to start with, so it was really hard for us to try and measure how that changed during the approach. And lastly for me, just to talk about the pilot that we used for testing the Communities for Change Wales approach. So our first collaborative was called the Cymtaf Morgannwg Sorry, it's quite a mouthful. Cymtaf Morgannwg Healthy Housing Collaborative. On the left in the larger blue square, we've got senior leaders and the wider collaborative. That's the Cymtaf Morgannwg Healthy Housing Collaborative. And then in the middle blue square, we've got the oversight and delivery group, which consisted of wider determinants of health colleagues who developed this approach, and the facilitators from Co-Production Lab Cymru. And feeding into that oversight group was the QLab Cymru support. And with that, I'll pass it on to Gwenno, who's going to talk a bit about how that worked in practice.
Diolch yn fawr, Catherine. Thank you. Prynhawn da bawb, good afternoon. My name is Gwenno, and as Catherine mentioned, I'm joining here as an associate with the Co-Production Lab for Wales. And our role in this process was to facilitate, so to kind of hold spaces for people to come together, provide some ad hoc support as and when needed, and doing some of that one-to-one session support, as Catherine mentioned as well. And to give you a bit of a taste for how did this work in practice, sut nath hyn weithio yn ymarferol, we facilitated online sessions, some of that with that core group of senior leaders, some preparatory work with them, and then also at various milestones of that 100-day challenge. So day 1, day 25, day 50, and day 100, we facilitated sessions for that wider collaborative to come together, review the goals and plan for actions. But to give you a bit of a flavour for how to move from the kind of theoretical and the blueprint side of things into what did it actually feel like and what were we as facilitators grappling with, I thought I would just share 3 questions that we were working through as we were thinking about how best to facilitate all of this work in practice and how to bring the process to life in a way that felt suitable to the people that we had involved in the process. And the first of those questions was really, where can we as facilitators add the most value? Lle allan ni fel hwyluswyr ychwanegu gwerth? Originally, we anticipated that we would hold the space for a lot of exploration around the challenge, exploring multiple different solutions and supporting the group to learn and reflect from lots of different testing of ideas. But actually, this group had real clarity over the challenge and what the solution to that challenge should be and what they wanted to try. So we really needed to reconsider as facilitators, where could we add the most value? And actually we asked the group this question, and our value as described by them was in that role of convening. So being kind of welcoming hosts to that wider collaborative, providing some accountability actually, and really getting clarity over decisions and actions and bringing them back and nudging people. And also that time to reflect on a one-to-one basis. I think there were mixed reviews on the usefulness of this one-to-one coaching space for each individual, but it was something that we could offer, and it was a way that we could provide some value in that process as well. But it's worth saying that we also got feedback that it perhaps felt overly facilitated towards the beginning of that process and that people wanted a bit more space. So as we went through the process and through those 100 days, we tried to create a bit more of that space for exploratory discussions and not be too wedded to specific frameworks and tools. Another question that we were grappling with when thinking about how this approach works in practice was, who are the end users and who needs to be in the room when things are being discussed? So pwy ydy'r defnyddwyr a pwy sydd angen bod yn y stafell ar gyfer y trafodaethau yma? The blueprint is really clear about the need to involve people who are directly affected by the problem and the potential solutions. And whilst this particular pilot, all the work was absolutely done in service of trying to improve things for local people, local citizens, but actually our explorations uncovered that the end users of this particular pilot were professional members of staff who were going to be using a data platform, and that actually in practice that meant that it wasn't quite the right time to engage with citizens, as it wasn't fair. We weren't anticipating to be using their expertise within those 100 days. So yeah, in practice, it meant a lot of consideration into who needs to be in the room, who are we actually genuinely asking for their expertise and advice, and making sure that no one was included as a kind of token gesture, that they had input and influence to be part of this process. And the third question we were grappling with in terms of how to make this blueprint work in practice was, how do we make this suitable for virtual collaboration, for virtual working? It was kind of set up as a project that would mainly be working online, and all of those milestone days that I discussed, all of that was convened virtually on Microsoft Teams. And something that we decided to do was to use Miro, an online collaboration canvas, as a central point to record all of our discussions and decisions. And this felt really important. We're talking now about starting work around autumn 2021 into springtime 2022, I believe, if I remember correctly. And, you know, we had another winter crisis, lots of cases of COVID within the group, and we needed to make sure that things were recorded, and if people couldn't make sessions, they could catch up. So that felt really important. We also had to think about some of those tools and techniques and frameworks in the blueprint. Some of those felt more suitable to face-to-face working, so we brought in new tools that worked a bit better online. And back to this idea of kind of feeling maybe overly facilitated at the beginning, but also people not having hours and hours for long screen time meetings. We try to work on that balance of having shorter meetings with space for quite exploratory conversations. And this was something that we were always trying to balance and get it right. And we know that some people would have liked to have some face-to-face working, so that would be definitely something to consider in the future. But just before I pass it on to the next speaker, I thought I'd end with a little quote and a bit of a caveat. When thinking about how this approach works in practice, I think it was really important for us not to get too hung up on specific tools and frameworks and the technicalities of the process. Yes, that's all evidence-based, and we were kind of holding that as our compass. But actually, at all times, we needed to remember this is a time-bound opportunity, 100 days for people to build relationships, either strengthen them or build new ones, so that something would happen beyond that 100 days. So we were always trying to bring it back to that. And I think this is a really nice quote from the evaluation of perthnasoedd sy'n bwysig, gwell perthnasoedd gyda'r potensial I fwrw ymlaen a phethau. So to hold that in mind whilst thinking about all the technical bits around practicalities. And with that, I'm going to hand it over to Philip.
Thank you very much, Gwenno. I'm going to take it that people can hear me. So my name is Philip Daniels. I'm a consultant in public health, and I'm the lead for health improvement at wider determinants in Cwm Morgannwg public health team. And I mean, as has been introduced, we were very keen to be involved in this. As with all health boards, but particularly Cwm Morgannwg, the appreciation that housing as a determinant of health has been long held. And the health board is going through a period of change, looking at its strategy up to 2030 and how it can start impacting on those wider determinants of health. However, we know that we don't have the levers directly. However, and it's strange looking back, because at the time we didn't have the relationships with, as Gwenno's quotes just indicated, we didn't have the relationships with housing staff either. So what this collaborative set out to achieve was for housing in its broadest sense, so that's local authority housing officers, that's registered social landlords, that's others as well, and health, to work proactively and constructively together on common issues that affect them. And in applying for this, for the support, in a way we had to identify, well, what is the problem that you want to solve, and what is doable within 100 days as well. And so we identified that all parties hold a lot of data, and we need to learn how to work together with our data, and we need to be in a position to share it. And so what was achieved during the action phase, I mean, on one hand, it was about developing those data sharing agreements, pulling together data sets, analysing that data, and planning action on it. But I mean, as Gwenno has said in that quote, it's about relationships with the potential to take things forward. What actually came out of it in reflection was that we now have brilliant relationships with each other across housing, health, local authorities, etc., around housing issues. And so, I mean, without labouring the point, that having that facilitation available to us, and having that space where we could develop those relationships really was the key learning point, but also the outcome of it. Next slide, please. So when I talk about what we're sharing data, what data do we have? Well, the housing, we obviously have really good data in terms of health outcomes, right? And at the time, and even bubbling on, Cwm COVID was at the forefront of everybody's mind, and the health board had brilliant data on everybody over the age of 5 who'd come into contact with health services within the past 2 years. So whether that's vaccination, whether that's hospitalisation, whether that's mortality, etc. The housing associations also hold a huge amount of data. They for a start, they know which addresses are social housing and which addresses are not, but they also have data on people who are potentially struggling to pay rent, for example, people that are involved in the well-being programs that housing associations hold. And so what we came up with in this program was we agreed that the registered social landlords would share a manifest of their addresses, and we would look at our COVID data to see if there was a differential impact of COVID-19 on people that are socially housed versus the rest of the population, bearing in mind that the rest of the population is both private owned and private rented. And as you can see from here, so on the left-hand chart is is on emergency admissions, and the right-hand plot is on COVID mortality. The red line is social housing and the blue line is the rest of the population. And as you can see, people in social housing, obviously we knew anyway that there was higher clinical vulnerability amongst the socially housed, but there's a marked difference in terms of COVID outcome by housing tenure. And that begs the question, well, what are you going to do about it, really? So next slide, please. So we get onto the crunchy bit, which is what we're going to do about it. So taking the relationships we had as a starting point. Obviously, we've completed the Communities4Change data sharing project, looking at COVID impact across tenancies. And a large thing that came out of that was we actually pulled together a housing health summit in Cwmtâp Morgannwg that had about 80 attendees from Welsh Government, local government, housing associations, community and voluntary sector, members of the community, for example. Next slide, please. We are in the process now, and one of the, I mean, this really struck home with the health board exec. This idea that we need to be working more closely together. And so I am shortlisting later this afternoon for this housing health programme manager, which is joint funded by the health board and the registered social landlord. So this person will be in post. We've got funding for 2 years, and they will coordinate the work between housing and health, which is fantastic. And we set up this Healthy Housing Alliance, which is a sort of bi-monthly meeting of housing and health to identify where we share problems and where we can share solutions, recognizing that local authorities, registered social landlords, health boards, we're all anchor institutions within Cwmtâp Morgannwg. We're not going anywhere, and we've got quite a lot of sway in terms of what happens. Next slide, please. So what we've got planned is that we intend to, in the background of this, there was work, obviously work is going on. I recognise that there's some people from Hywel Dda here today. Gareth Morgan from Hywel Dda won a Bevan Exemplar funding to develop a best practice guide, and we intend to use that and audit the approach over the next year for how well Cwmtâp Morgannwg as a health board is engaging with health. We are expanding the housing health data sharing work that we're doing, and I'll come to that slide in a second. And we are developing a joint healthy housing work plan. Next slide, please. So the plan then, now that we are working well together, the plan is to link the National Energy Performing Certificate, the EPC, records with health data, and to identify clinically vulnerable Cwmtâp Morgannwg residents who will be living with poor housing, in poor housing, in short. Next slide, please. And there's funding available nationally. So there's 2 funds, Eco4, LA Flex, we're talking about £2 billion worth of funding. And the intention effectively is to, whilst those are available universally to anybody on low incomes living in a house with a poor EPC rating, we can start identifying those individuals who would particularly benefit and start pushing that proportionate universal approach, so helping those that need it more. And that wouldn't have been possible without the work and the relationships that we had consequent to the C4C grant. Next slide, please. So we've got a bid in for £22,000 for pilot activity. There's a potential for £1 million rollout funding, with the potential to roll this out across the Wales and the UK. So without further ado, I'm going to pass over to Christian.
Thank you, Philip. Next slide, please. So I'm just going to talk about, in the final part of our presentation, a little about the evaluation which we've undertaken on the approach. So I work for the Wider Determinants of Health Unit in Public Health Wales and was part of the project oversight group for this work. The evaluation was undertaken by the Wider Determinants of Health Unit with support from Research and Evaluation Division in Public Health Wales. The evaluation focused on both process and outcomes, and the questions which we were specifically trying to address through the evaluation was to consider the extent to which the approach was implemented as intended, i.e. the approach that was outlined in the blueprint. Following Kilpatrick's model of learning evaluation, we were interested in participants' reactions to the approach. Did it change any aspects of their practice? And what did they learn through undertaking and being part of the Communities4Change Wales collaborative? We also wanted to reflect on the extent to which the assumptions were correct or incorrect in the theory of change which the project oversight group delivered. And finally, we were interested in what did the collaborative achieve in terms of outcomes. I'm not going to talk about that specifically now because Philip has talked a lot about what was achieved during the actual collaborative and thereafter how it's gone on to grow. Next slide, please. So in terms of the evaluation approach, a qualitative methodology was used to undertake the evaluation, which involves semi-structured interviews with members of the collaborative, the project oversight group, and Cubelab Cymru members who supported the oversight group. Virtual semi-structured interviews were undertaken at 3 points in time. At phase 1, which was at the start of the action phase, out of a potential of 23 participants, nearly 80% took part in the interviews. At phase 2 was at the end of the 100-day action phase, and just over half of potential participants took place in the semi-structured interviews. And then at 6 months later, we followed up with the senior leaders, of which 2 of the 4 participated, to really look at what Philip's described in terms of what happened after the collaborative. A thematic analysis was used the recognised approach, and we used Atlas software to analyse the transcripts. Next slide, please. So in terms of the implementation approach, a key theme which came across the interviews was the nature of the collaborative, the problem that they were trying to solve. And as Philip and Gwenno and other speakers have said, this was around developing a mechanism for sharing information between health and housing. And the solution, which focused on developing an information dashboard. And through the interviews, this was some question was put back as to whether this was appropriate for actually testing the approach outlined in the blueprint. The issue by and large was a technical one, and as previously been described, the senior leaders had a fairly clear idea of what the solution was during that preparation phase. For this reason, some of the core components of the approach weren't followed. In particular, the approach focuses on deep diving particularly into the problem and generating a range of solutions, and discusses in the blueprint around the process of iteration. Also, from the facilitator's perspective, they felt that the blueprint, and this is something Gwenno has talked about, it should be seen more of a menu of options that could be tailored depending on the nature of the problem and the potential solutions and the nature of the collaborative. As Gwenno stated earlier, during the 100-day action phase, they adapted aspects of the blueprint to meet the needs of the collaborative and following feedback from collaborative members. Next slide, please. In terms of participants' reactions, I think what really comes across quite strongly in the evaluation is the recognition, particularly senior leaders recognise that a time-limited action phase has really focused their minds and provided a structured approach was beneficial to galvanising around a specific goal. And in addition, as Philip has said, really to develop those relationships. The preparation phase that consisted of 2 2-hour workshops, and it was apparent from the interview data that senior leaders and project oversight group had reflected that this perhaps wasn't sufficient time. In particular, gaining a full understanding of the Communities for Change Wales approach, spending more time on actually establishing and building relationships within the senior leadership group was felt to be really important, and really getting to understand each other's perspectives, given that it was a number of different organisations involved, and really considering the life of the collaborative once the action phase was over and support from the delivery team had ended. Some of the senior leaders, as was discussed previously, also felt initially that some of the workshops were very structured and very facilitated, with one senior leader saying that they felt like they needed a bit more room to breathe and room to think and reflect, and more, in essence, to a space to follow their noses rather than very timetabled and structured sessions. The coaching sessions, as was said before, were seen by senior leaders in 2 ways, really, a bit of a mixed response, with a couple of senior leaders really seeing this as beneficial to be able to really reflect on their space as a leader. And also in terms of other leaders, though, they actually felt that they were slightly unsure as to what were those coaching sessions for at the beginning of the process. So there was a reflection that perhaps we needed to, in that preparation phase, really describe what these coaching sessions could be for and how they could be used during the 100-day action phase. There was also some concern, given that the person doing the one-to-one coaching sessions was also part of the delivery group, in terms of what the boundaries were around those coaching sessions and how information might be shared. Next slide, please. In terms of the assumptions we've made in the theory of change, by and large, these were broadly upheld, although it's probably worth reflecting on that the whole process itself, in terms of the project oversight group and the efforts within the collaborative, was that this took considerable capacity, and we're probably slightly underestimated the degree of capacity that the activities would require. Secondly, one of the assumptions we had made was that there was agreement on an exit plan for after the action phase, and an agreement around what that plan might look like very broadly during the preparation phase. And in particular, because of the short preparation workshops which we had, we probably didn't get round to this phase. So there wasn't, although there was some ideas of what might be the next step, and there was some discussion around a stretch target in terms of the goal that was trying to be achieved. There probably would be fair to say that the exit plan wasn't particularly formed at that very early phase. Secondly, we had assumed, in line with the blueprint, that the particular problem, that a number of different solutions would be tested and that there would be some iteration. However, given the nature of the problem and actually just the capacity to develop different solutions, and the fact that we did fairly early on have a fairly well-formed solution, this wasn't actually upheld from the theory of change. And finally, we were originally interested in seeing whether the collaborative and the senior leadership group had at baseline a growth mindset, or whether this was something that was developed as going through the process of the 100-day challenge. And by a growth mindset, I mean things like being characterized by trust, optimism, compassion, adaptability, empowerment, and psychological safety. Unfortunately, within the constraints of the evaluation, we weren't able to measure that, but that is something we're particularly interested in. Next slide, please. So overall, the key learning points from the evaluation are that perhaps most participants in the collaboration really saw the value of the time-limited, highly focused and structured approach as a real catalyst to coalescing around a goal and accelerating change. The blueprint draws heavily on literature from transformational change and innovation, and the approach is perhaps therefore, in its purest sense, best applied to larger scale change efforts rather than more incremental changes. So the nature of the problem and the context in which the problem resides is really important. What in particular we learned, particularly as all the contact for the collaborative members was done virtually, was the importance of giving sufficient time to really build those relationships with the senior leaders in that preparation phase. And in addition, finally, I think it really showed the importance of exit planning at the beginning, and really allowing time in the preparation time, even if we haven't got a clear exit plan, to really think, well, if we did achieve the goal, what would be the next steps? If we didn't achieve the goal, we'd set ourselves what? So to look at different scenarios. So perhaps more time, once again, in that preparation phase could have allowed that to happen. Next slide, please. So this was one of the feedback from a quotation from one of the senior leaders, which I think probably encapsulates particularly what the approach does in terms of acting as a catalyst. So I think in conclusion, through the pilot, we've learned that the approach provided the fuel, metaphorically that is, to light the Kindle and accelerate action. But it is quite a resource-intense approach, and in particular, consideration needs to be given to what happens next once that structured support has ended. We recognise that some of the approaches, some of the components outlined in the blueprint were not fully tested in the pilot. But what we learned is that actually the blueprint could act almost as a recipe or menu, which could be used to plan and guide and deliver multiple agency change initiatives. We're now at the stage of considering refining that blueprint further following the evaluation, and then thinking about how we could support partnerships to use it. Certainly within the wider determinants of health unit, currently we don't have the resource to support change efforts through the whole 100 days, but we are considering about how, in actual fact, the blueprint could be, we could use it to support other partnerships. So the evaluation report hopefully will be available over the next week or two on the Public Health Network Cymru website. So thank you very much for listening, Diolch yn fawr, and I'll hand back to Kieran.
Thank you very much, Christian, and thank you to all our 4 speakers today for taking us through that journey. And it's really interesting to hear how those relationships are really so vital and so important. And I think the qualities like adaptive leadership certainly come through from that discussion, and the importance of intersectoral working together. We've had a few questions, so if I might start, and anyone with any other questions, please do put them in the chat. Philip, perhaps this one will be for you. The question is the energy
is there scope? Is that?
No, is it, well, before we get to that, is the energy performance certificate intervention specifically for social housing?
No, it's everybody. So I can answer Charlotte's question at the same time, right? Charlotte Gray's question. So the APC data, it's any house that's been sold within the last 10 years, really, or been rented out. So if you rent out a house, you have to get an EPC. If you've sold your house or bought a house, you need to get an EPC. And so it's across the board. And of course, not everybody's sold or rented a property in that time. However, using an approach not different to that old Microsoft game of Minesweeper, if you remember it, you can extrapolate what the likely EPC is if you know the EPC of adjoining houses. So we can give a very good guess that's been tested. I mean, I can send around the links for that. So you can pretty much get a comprehensive EPC rating for any property in the UK, really. Going back to Charlotte's question, is there scope for exploring other social tenants in health or private rentals, etc.? So there's no local authority. There was complete stock transfer in Cwmtaf Morgannwg to housing associations, right? So that isn't there. In terms of private rental,
we know we've got a huge issue in Cwm Taf Morgannwg in terms of the quality of private rented accommodation. However, there's Rent Smart Wales who aren't too happy about blanketly giving all of the addresses of the properties for obvious reasons. And then we know that there's a lot of private rentals that are off the books as well. And so it's quite difficult to dig into that. However, going back to that EPC data, the data set that exists for the EPC will state whether the house is privately occupied or whether it's rented. So you can do a sort of mosaic approach to piecing together the data sets we have and link those data sets to get a reasonable understanding, as well as the record of houses of multiple occupancy, which every local authority is supposed to keep, which are kept to various standards across Wales. And so if we wanted to look at private rental, it's a case of linking up multiple data sets, in short.
Thank you for that. We've another question, which is, have those involved in the pilot user learning or might consider user learning to go again? So I guess there might be two elements of that. One is to go again with another time-bound action phase, but I'd also add to that, is there learning you've taken away from the process you will apply in your day-to-day job or work with partners? So.
Yeah, definitely. Unfortunately, my colleagues couldn't be here today. I did ask them. Yes, I mean, to both parts of that question. So, I mean, all of that stuff about building the relationship and everything coming from the relationship and having time actually to communicate. As Gwenno indicated, at the time, we were in that sort of grey area post-COVID where we were just getting used to Teams and there was still some anxiety about meeting up in groups, etc. And that did challenge things. Subsequently, we met face-to-face as well, which has really reinforced that, which has been very helpful, I have to say. In terms of that time-bound action phase, as I say, the same team have subsequently got together to put in for grant funding, which has been very much sort of to the wire in terms of the deadlines. And so it's been very similar. It's been and because we've gone through this process, it's far more natural relationship where we're sending each other unfinished drafts and saying, can you comment on this and what do you think of that? And so it really has facilitated good relationships between us. So yeah, both.
Great, thank you, Philip. And we've another question. I think probably, Philip, you're best placed for all of these, I'm afraid, because they are focusing on the kind of housing element here. Is there a way to filter those accessing mental health services, in particular secondary mental health services?
Yes. Yeah, we can just use the clinical record and identify. I mean, we'd need a use case because we're not going fishing, but yeah, I mean, you could conceivably, if we could look for any health condition if we know somebody's address, and we could yeah, but we'd obviously have to be very careful, especially looking at mental health, why we were looking into that data and how we were going to use it. But I mean, in reality, yes. I mean, if you're doing it, I don't know where Annette is from. Where are you from, Annette?
Unfortunately, she's muted, so she can't tell us. But if you want to drop it in the chat,
I mean, if you're working in a health board, Annette, this is certainly something you could emulate. I mean, if you talk to the if you're interested in social housing residents' use of mental health services, then putting together your registered social landlords to get a manifest of the addresses. One of the things we did, and it's been in abeyance for a number of reasons, but is to start integrating, identifying within our health board dashboard social tenants. And so you can look at unplanned admissions, you can look at ambulance uptake, you can look at admissions for particular conditions, etc. So you could do any of this, really.
Great. Can I just ask a related question to that myself, which is just around the information governance aspects and how that played out in your time limited position?
That was the major issue. So, I mean, if you think that registered social landlords are essentially companies, right? So there was stock transferred to these social to social landlords, housing associations, but they're in competition with each other. The local authorities and health, and I'm not speaking outside of school. I mean, the relationship hasn't at many levels and across many departments hasn't always been great in terms of health and social services talking to each other, health and housing talking to each other, etc. And so there were two elements of it. What this program did was help facilitate the trust between the individual officers, right? So we were able to go back to our respective organizations. However, there's still that challenge of the existing governance and the fact that we had to get those data protection impact assessments done. We had to pass it through the governance processes within our respective organizations, and we had to get it signed off. And so that is what took the longest time. And you sort of you do end up arguing or talking through the finer details of what do you mean by this. Who, for instance, who is going to hold the data? Who is going to analyze the data, right? So yes, health wants very much to plug in other people's data, but it doesn't necessarily, for good reason, wish to release its data to housing providers, for example. So in the end, we had an agreement that the housing providers would provide us with the bare minimum, which was the addresses. So there's no personal identifiable data, and we would do the rest in-house and give the output back. And so that's how we got around the data governance issue.
Oh, interesting. Thank you. From just to Annette come back to us, Advocacy Support Cymru, and it was just about wanting making the link between mental health and housing. And
yeah, please get in touch, Annette, if you're interested, because I know we'd be. I'm happy to talk.
Right. Christian, a question from Charlotte. Which is that this shows the value of Community4Change approach. So what next?
Yeah, I think, as I said before, we've recognised that internally as a team, we don't currently have the capacity to deliver it through to support a number of different multi-agency partnerships. But I think what we are considering is how can we enable others to use the approach. So I think that's really our next step, is how we can actually enable others to use it, whether that's some kind of toolkit with some kind of training. I think what's really key as well, as we've learned through this, is the skill of the facilitators as well being a really important aspect to this. So I think that's something we would also need to perhaps consider as another, almost like a check to that actual blueprint. Some of the really key considerations that if you're going to take this on yourself, what you might need to think about. But certainly I think that's what we want to do, is to hand it over at this present stage.
Yeah, and I just add to that, I think we're in a situation with time limited funding, as these things often are, and we're really fortunate to get the support of Gwenno and her colleagues who were very skilled. Yeah, and I think the other thing I'd add is if there's anyone dialing in today or who watches this later who's interested in trialing it locally or in a particular context, do get in touch, because we'd be really interested in exploring how we can support that and maybe developing some tools to help us support others too. So it looks like that's the end of our questions for today, and it's a good time as well. So a huge thanks to everyone for the contributions and for sharing the learning and for your honest, reflective sessions on what's gone well and what the challenges were. And if you've any suggestions for future topics, please get in touch and let us know. And in the meantime, if you could fill in our evaluation of today's session, there's a link in the chat, and I look forward to seeing you all at future events. Thank you very much. Take care.
Thank you.
Bye bye.
Ciao.
Yeah.